Okay, and we are live for the amended segment for Conversations and Opinions. We are featuring Zelda. She is a person who has graced us with her presence to come on today to help add to the conversation that we had previously. So, thank you, Zelda, for joining us again, and thank you for taking the time out.
You're welcome.
All right. So I know that the last time we chatted, you gave us some of your credentials. We do know that you're a registered nurse. You work in a specific field, but you are a trained medical professional and you're here to share some advice with us. But I know that you had a disclaimer that you wanted to share before you opened up conversation with us.
Well, thanks for having me. But I'd like to put a disclaimer that this is not in place of your um, doctor's appointments, your doctor's advice, your doctor's consultations, whatever your healthcare providers provide to you. This is just some additional information.
Okay, perfect. And the conversation that we had really leaned on how to advocate for yourself and knowing the difference between certain things. So I'd like to just pick up where you were giving us really great advice on how to, let's start with the advocating portion. What does it mean to be an advocate for yourself in the medical field or in the medical sense?
Well, in order to advocate for yourself, you need to learn how to navigate the system. There's so many things and there's so many specialties right now because doctors as well as nurses are specialty and people will listen to what they want to hear, but sometimes you need to take that to a specialist. Most of us have internists or general practitioners. For instance, if your blood pressure is too high and they're trying you on 3 or 4 different medicines, perhaps you should try and get a cardiologist, somebody
Okay.
who works directly with. Or if you want to navigate the system and like you've had diabetes and all we're doing is constantly changing your medication, you might want to look into an endocrinologist. It's just different ways to have more personal and direct care as opposed to having a general sense of care. And so just advocating different things for yourself and don't take anybody's word for anything. I mean, yes, your doctor has a lot of information, but he doesn't have all the information. And sometimes you have to research for yourself. Is there a second opinion I need to get? And a second opinion is not an offense towards your primary care. It's you protecting yourself and knowing what's going on directly with you.
That's a really great thing that you brought up. I just want to interrupt really quickly because a lot of times when people are trying to advocate for themselves, we have that internal like courtesy or respect. We don't want to hurt anybody's feelings. So how do I, if I have a doctor who I've been seeing for quite some time, but I'm not comfortable accepting a diagnosis or any, just if I want more information or if I feel like I haven't been serviced fully, how do I go about getting a second opinion without A, offending the first doctor and without B, seeming like a quote unquote quack for going doctor to doctor to get information?
Part of the way that I would start with that is that I would first of all find a physician and work with your insurance because a lot of times what people don't know is their insurance won't pay for second opinions at different places. So find out from your insurance first of all how you would do it. Secondly, just go to your doctor and say, I've been looking into this and I just want to go get a second opinion. Most doctors are not offended by that. Sometimes they even welcome the help, but they don't offer it because they're not, doctors generally don't know what insurances will and won't pay. And they don't want to put you in a false sense of hope to go and say, yes, I recommend you get a second opinion. And yet the insurance says, no, we don't. Or the second opinion is not within your network. And are you willing to pay for anything above what your network will pay?
So how do you know as a person who's seeking medical advice or medical help if you need a second opinion? Say I've had chronic headaches for quite some time and I've been going to the same primary care physician and I just don't seem to be getting the relief or the help that I need. Do I need a second opinion? Do I need to request a different medication? Do I need to see a different type of doctor, someone who specializes in an area that may be a little bit more well versed on the actual head pain and things like that?
Well, yes, couple things about like let's say you do have a headache that is not diagnosable by your primary care doctor. Maybe seeing a neurologist, maybe seeing a endocrinologist, maybe your hormones are off, maybe
Mhm.
you're having some nerve damage, maybe it's an underlying condition. So some of those things would be going to start with a neurologist. Some of those things would be starting with an endocrinologist, but you have to do a little research on your own before you approach the situation. It's
No,
not that
no.
hard, but it's the how much time and how much are you worth.
Okay, so just for those of us who are not well versed in all the different types of specialties, a neurologist specializes in.
Nerve endings, nerve pain, and it could be nerves that causes a headache,
Okay, and the endocrinologist, they specialize in.
hormones and diabetes and things like that.
Okay, okay. And then your primary care physician, they specialize in just general care. Tell us about what that, because most of us either have a family practice doctor, primary care physician, or something that has a more general terminology associated.
So there's two different ways to look at it. A general practitioner will see children. They will see everybody. It's a family doctor basically. However, an internist is a doctor that sees mostly adults, and with adults, they tend to look deeper into the problem. Whereas a general practitioner doesn't have all of that time or not even all the expertise to do that. So, as an adult, if you're finding that you have more ailments than you used to and nobody's being able to address them, I would look into getting an internist as a physician to look into. Maybe they can at least pinpoint some things and direct you in the right position.
And I know we didn't discuss one of these topics that I'm getting ready to bring up, but I wanted to ask two parts. How much does stress play? How large of a factor is stress when it comes to subsequent illnesses? Because we hear all the time, oh, don't stress yourself out. Oh, you're going to give yourself a stroke. You're going to stress yourself into an aneurysm or something like that. Is there any truth behind stress being directly associated with illness and disease?
Yes. Number one, stress also is like a pinpointer for things that are already there. So it can, I want to say exacerbate, but I'm not sure if everybody knows what that means, but it can heighten what is happening. Meaning that if you have high blood pressure and you have stress and your normal medication is not regulating your blood pressure because things are higher than they used to be. So you may have to go back to your physician and get a different dose or maybe figure out some ways to decrease that stress. I mean, right now we're dealing with so many stressors that are external, and then whatever is added to your internal stresses, like your family, your work, your private life, and then the external stresses that are happening globally every day, depending on how you manage stress. A lot of people like meditation. I can't focus my brain enough to do meditation. So, what can you do to decrease stress? You have to figure out what that means. If that means for you sitting down in the dark and having a cup of tea and letting your mind just wander off, that might be it. But sitting there for me and just sitting there quietly with my eyes closed, trying to focus on like one thing never works. But I can come in, and one of the things I do is come in and I can lay on the couch, turn the music on, and just lay there and veg out. So that tends to work for me, but you need to find your own stress de-stressor.
Okay, so even though meditation is something that you've mentioned, and we do know that as a very popular practice for people, even more so down to children these days, because they are being taught in schools to stop and breathe and think and use words like Zen or relax and things like that. So even though that method doesn't work for you, that may be one that works for other people, right?
Yes.
Like you said, with most of us, like yourself, sit down, chill, turn on the music that you like, and just allow your body to, soak in the calm.
Unwind.
Mm-hmm. Okay.
I also know that exercise works. I'm not that person, but I know that when I do it, it does bring down, it heightens my serotonin and brings down my stress. And everybody can't do exercise to do that. Some people are doing it just for the physical fitness. And it will decrease a lot of stress. But it's up to you. You have to figure out what works for you. One size does not fit all. And I think that's where we've gotten to in this country, that this pill works for everybody. This exercise works for everybody. This works for it does not. You have to know you and what works for you.
Okay, that's really great advice. And you touched on exercise, which kind of pushed into the other question I was going to ask about the role that your nutrition plays in your overall health. Now, we are all most of us are individuals who understand that what we put into our mouths does affect the way our bodies, operate, how our hair grows, and how we, as children, we always wanted to eat our vegetables and drink our milk as we were told because you'd get big and strong and all that good stuff. How big of a role does nutrition play into disease and just overall wellness?
Um,
Can
Number
you
one,
eat yourself sick?
you can eat yourself sick or you can eat yourself to death. One of the things that you have to realize is that your taste buds need to mature. Your lifestyle needs to mature. The things you ate as a child, because that's what your parents fixed for you. And parents are not always savvy. They're doing their best with what they have. So things like spaghetti and pasta. Pasta is a huge proponent of increased carbs, okay? But nobody thinks of it as carbs, but we like to add garlic bread with it. Those things are definite weight gainers. And when you put that much weight on, you don't even know you're doing it because what's happening is we use food for so many different things as opposed to health. We use it for comfort, stress reliever, we use it for social life, we use it for so many things as opposed to what it's supposed to be used for, and that's to nurture our bodies. And you can eat yourself into a frizzy. Like one thing that I know that my family likes are chitterlings. Those are awesome to me. However, that growing up, that's what we ate, not because it was the greatest thing on earth, but that's what we ate. So growing up, instead of me maturing my taste buds, I should have gave that up. But now everything is moderation as opposed to just cutting things completely out.
Okay, that's good to know. And I'm glad that you mentioned, um, and like you said, parents are doing their best, but knowing as a parent that you can make better choices that are going to be beneficial for your children in the long run is super helpful because spaghetti is one of those meals that if you have children and multiple children and you may be on a budget, that's a stretch meal. We know that spaghetti can last more than just one sitting. You can have spaghetti for dinner tonight and then you can possibly feed it to the family the next day too. So if you're a person who's budgeting, you're not necessarily putting at the forefront the carb count that you're feeding your children. You're wondering about full stomachs and, people who are able to say that they feel satisfied to go to sleep and not feel hunger pains. So I appreciate you saying that. And just one last thing before we go, um, give us just your overall on how to be the best version of yourself health wise. Now I know you're not, like you said at the beginning, this is a disclaimer. You are a person who's in the medical profession and this is your advice to us, but we're asking. So we want your opinion on things that we can do, just small steps to help to in our community lower blood pressure, lower the instance of diabetes and pre-diabetes within our youth and things like that.
A couple things that can happen that would make it a lot better. And we have gotten ourselves into a position as Black people, um, of eating less vegetables than most cultures. We need to increase our vegetables. I didn't grow up eating broccoli. Mostly we ate were greens or beans. We did not eat a lot of broccoli and cauliflower and different fruits, eggplant, different. There's so many vegetables as an adult that we don't eat because we didn't eat them as children. And now we need to mature our palates a little bit to add those vegetables and those fruits that we did not choose to eat or did not have to eat. And that will definitely decrease some weight. Decreasing weight will decrease blood pressure. Decreasing weight will decrease in diabetes. Decreasing weight can decrease arthritis, painful joints. A lot of things can happen if we increase the vegetables and decrease some of that protein, meat based foods. Because one of the things that we know lately in our country is that in order for us to actually have food, we're putting hormones and steroids. Go for the more nutritious food, the organic foods. I know it's expensive, but if you could add some of that, I think that would be helpful to decrease a few things. Adding vitamins and minerals without your doctor asking you, it doesn't help. because if you're not deficient of those things, it doesn't add any benefit. Make sure that when you're taking all of these extra nutrients and extra vitamins and minerals, that is something that is your body requires, not because you've taken some advice off of the internet and used it as part of your new lifestyle change. Make sure you talk to your doctor when you're making those big lifestyle changes. You don't want to be the person that's making all the lifestyle changes and not benefiting but hurting yourself.
Oh, that just opened another can. Well, we will definitely have to have you back for an episode on how doing what you think is best for yourself could possibly be hurting you. So we appreciate that. We are so grateful for you sharing your time with us and lending your expertise and just your personal advice, because we do care and we do, we want to use this platform to give information and to share knowledge. So knowledge is power. And thank you for sharing yours with us tonight.
Thank you. See you next time.
Bye.